Gretel.
Yes. Ms. McFarland, thank you for attending to give your evidence today. You've also provided a helpful witness statement to this inquiry, which is reference INQ 000588023, which you should have in front of you. Ms. McFarland, I'll begin by asking you about your professional background and the setting up of long COVID kids. What is your professional background?
So before the pandemic started, I was a Pilates and health coach specialising in women's health and fitness. And before that, I worked as a nursery nurse and maternity nurse.
Thank you. You set up Long COVID Kids with Frances Simpson in September of 2020, is that right?
Yes.
Okay. How did you and Frances come to set up this organisation?
So after our children got sick, we connected online, and Frances had published an article which I had read in the BMJ, and I asked her if she would validate my concerns and work with me on trying to pull together families.
And Long COVID Kids supports, represents, and advocates for children and young people who are living with ongoing symptoms of long COVID. Is that right?
It is, yes.
And the organization advocated for mitigation measures in schools, improved indoor air quality, further research, and vaccination. It is a volunteer organization and supports about 11,000 families. Is that right?
That's right.
Okay. Does Long COVID Kids operate throughout the UK?
It does, yes.
It operates in Scotland, I believe.
Yes.
And we have a statement also helpfully provided to the inquiry from Miss Helen Goss. Can you help us with the nature and extent of Long COVID Kids' involvement with Northern Ireland?
So we have a representative for Northern Ireland who fed back to all of us about the experiences of the families there. Our representative has a daughter who's very sick with long COVID, and he helped her to advocate by writing letters and sharing her experience throughout the early pandemic.
And did that representative engage with the Northern Ireland administration? Do you know?
So there wasn't a coordinated approach. Several young people wrote letters in an attempt to get engagement, but there's no action that we know of.
Okay, thank you. I'm going to ask you now some questions about the impact of long COVID on children and young people. I'd like to begin by reading out a passage from the Children and Young Persons Voices report, which was commissioned by this inquiry to hear directly from children and young people. Yes, very efficiently brought up on screen already. And for the record, the reference is INQ 000587936. Children and young people who reported severe, lingering post-viral conditions described distressing and persistent health impacts due to their illness. Examples of impacts on physical health included frequent hospital appointments due to chest pain and needing to use a wheelchair due to mobility issues. Those interviewed included some who were classified as disabled due to their illness. And one account received from an individual aged 17 years old is, "I've been mostly housebound these last 3 years. And if I do need to go out and walk, in more than 5 minutes to hospital appointments or just for fun, I need a wheelchair. So yeah, it's pretty unrecognizable from how I was in 2019. Does this account accord with the lived experience of your members?
Yes, it does.
Okay. To give us a sense of the proportion, that can come down now, thank you. To give us a sense of the proportion of children and young people affected by long COVID, you touch on the numbers at paragraphs 23 and 28 of your witness statement. But Could you tell us roughly how prevalent long COVID is?
What we know from the ONS statistics is there's over 100,000 children and young people in England and Scotland alone living with long COVID, and it's likely that those figures are grossly unrepresentative of the actual figures.
So if I can, in your statement at paragraphs 23 and 28, you cite the US Recover study, and that states that nearly 6 million children are living with long COVID, and that it affects up to 10 to 20% of children with a history of COVID. Does that sound about right to you?
Yes.
Yeah. And the US Recover study is obviously focused on children and young people in the United States. Is that right? Yeah.
That's right.
And in your statement, you cite the ONS statistics, and you say that in the UK, tens of thousands of children and young people are affected. The ONS last estimated that almost 66,000 children suffer from long COVID symptoms for more than 12 weeks. Does that sound right?
That's right.
Okay. And can you help us, and you might not be able to, but with whether those ONS figures relate to Northern Ireland?
So I believe the first set of ONS statistics did, and then the latter ones did not.
Okay. And the ONS figures are for children suffering symptoms for more than 12 weeks. And that would encompass, I imagine, quite mild symptoms, but also the kind of serious and debilitating symptoms that some children and young people suffer, as set out in the Young Voices report. Can you help us with whether there are any statistics on severe long COVID?
No, I think really that's an area that we need data and further research. Children who with severe symptoms have been overlooked. They're often unable to attend medical appointments, so they're missing behind closed doors.
I see. Your witness statement details the impact of long COVID on children and young people's education. And Long COVID Kids launched the Attendance and Education Experiences Survey in collaboration with the University of Derby in February of 2023. And at paragraph 85 of your witness statement, you set out the aims of the survey. So it was to gather detailed information about the educational experiences and attendance patterns for children and young people with long COVID in England, Scotland, Wales, and Northern Ireland. And can I ask you, how many responses did Long COVID Kids receive to that survey?
We received 317 responses from children and young people between the ages of 5 to 19 years.
Okay. And can you tell us whether any of those responses came from Northern Ireland?
A small proportion, but I'd have to come back to you with the exact figures.
Okay. And participants in this survey, they were recruited, I believe there were requests for their involvement posted on Long COVID Kids' social media channels. Is that right?
That's right.
Okay. And just before the break, if I can ask you about what the survey found, and it's not a memory test, so let's start with paragraph 88 of your statement, if that helps you.
Thank you. So the full results of the survey are being prepared for publication at the moment. We found that 69% of respondents reported that their education status had been affected in some way by SARS-CoV-2 infection. We found that a child with long COVID will lose an average of 20.6 learning hours per week when scaled up to the total respondents of this survey. It's over 100,000 lost learning hours per year. We found that 10.4% of respondents are currently temporarily away from school or college, sick, and that 9.5% are currently too unwell to be in education at all. and 75% of respondents reported that their attendance had been greatly impacted, with 54% saying that their progress with learning had been greatly impacted. 40% of respondents thought that the school lacked an understanding of the impact that long COVID had on their child or their young person's education, and 25% had experienced pressure from schools to send their child or young person to school when they have been unwell, and we still hear about that every single day now.
Pressure for unwell children to attend school?
Yes.
I see. We have just a few minutes before the break, so I'll ask you another question. You referred in your statement to the COSMO study, which my lady will hear more about in the course of these hearings. But the study is the largest of its kind into the effects of the COVID-19 pandemic and the cost of living crisis on the life chances of a generation of young people. And you've referred in your statement to a briefing published in January of 2023 following following the Wave 1 initial findings. And if we can pull up a quote from the study, which you've included in your witness statement. Yes, at paragraph 99. When considering the severity of long COVID, it is apparent that having long COVID with a severe effect on everyday life is consistently associated with lower GCSE scores. Having severe long COVID is linked with about a 0.3 standard deviation decrease in teacher-assessed GCSE scores. The findings show that pupils with long COVID with a severe effect on everyday life achieved lower scores than their peers who did not suffer from this experience when all other variables are held constant. Severe long COVID is therefore a risk factor for young people's educational attainment. The long-term disruption to a young person's education, daily life, and potentially to their mental health of having severe long COVID may be a possible explanation for this pattern. Does the results from the COSMO study accord with the lived experience of your members?
Somewhat, yes.
Okay. I think I'll pause there. We're due a break, my lady.
Thank you, Ms. Butler. I think we'll break now. I hope you understand, we take a regular break for everyone's sake, but especially the stenographer. So I shall return at 11:30.
All rise. Yes. Ms. McFarland, just before the break, we were discussing the COSMO study, touching on the impact of the pandemic on children and young people who have long COVID, on their education. Mm-hmm. You highlight in your witness statement the unequal burden of long COVID according to people's social background, children and young people's social background. Can you tell us about research concerning this unequal burden? And for your reference, it's dealt with at paragraph 167 of your witness statement.
Thank you. So this is in reference to the COSMO study, which reported that patterns of long COVID were also found to vary by young people's social background. 1 in 5 comprehensive state school students who reported having COVID-19 either currently have or previously had long COVID, compared to 1 in 6 grammar and independent schools, school pupils, 16%. Furthermore, the study found that those from the most disadvantaged areas of the country are more likely to report long COVID compared to those from the least deprived areas, 25% versus 18%. These findings further illustrate the unequal burden of long COVID on children and young people from lower socioeconomic backgrounds, and they highlight the need for targeted support and the importance of addressing structural inequalities in both research and service provision. This should be a key area of investigation for the inquiry.
Thank you. I'd like to move on now to a new topic, which is the government response to long COVID in children and young people. Dealing first with the issue of communication about the risks of long COVID, your statement sets out the absence of communication about the risks of long COVID to children and young people and their families. And that's dealt with in your statement at paragraphs 33 to 39. And I'm going to ask you in particular about a statement made by the UK's chief medical officers. So a statement was made on the 23rd of August of 2020, just before schools were to return in the autumn term, in which they said that the risks to children and young people were low, and very few, if any, children or teenagers will come to long-term harm from COVID-19 due to solely attending school. In your view, did this statement give parents the necessary information about the risks of COVID infections for children and young people?
Absolutely not. This statement misled parents to believe that children and young people were unlikely to be harmed by infection. And as a result, our support group was filling up with families desperate for help.
I think you've said in your statement that you appreciate the need, perhaps, for the chief medical officers to reassure parents. What do you think, in your view and that of your members, should have been done differently, bearing in mind that need to reassure parents as well, to provide information about long COVID?
So I feel like there's a balance between reassurance and the facts. And as parents, we want to know the facts about how to protect our children. Responsible health communications would consider how the media will interpret them, because it's often the media that families see reporting information if they're not specifically seeking it out. And I find it extraordinary that the precautionary approach was not taken with regard to children's health, particularly given the well-established knowledge that post-acute sequelae from other viral diseases and what they can do and how they can affect children.
I see. I'm going to take you now to some email correspondence between the Chief Medical Officer for England, from whom we'll hear at the time, Professor Sir Chris Whitty. So email correspondence in May 2020, in which concerns regarding the emergence of pediatric multisystem inflammatory syndrome were discussed. So we'll bring up the email now. It's INQ 0000699216. And if we can start just on page 2. Unfortunately, some text has been redacted about the recipients, but I can say that it is an email from Russell Viner, who, my lady, you will hear from later on in the hearings, from the Royal College of Child and Paediatric Health. And it is an email to Professor Sir Chris Whitty and Patrick Valence about pediatric multi-system inflammatory syndrome, dated the 12th of May. And in that email, we can see it is a discussion about concern. So it says, we had an updated call yesterday, which somewhat raised my level of concern and changed the picture slightly. So thought you should be in the picture. I have real concerns about how we balance this with the issues about public confidence in schools. And he sets out the sort of numbers that they're concerned with. And the severity of the syndrome. And then if we can scroll up now, pardon me, just to page 1, we can see a response here from Patrick Valence saying, this is concerning, as you say, and will raise anxiety amongst the public. It's very important that it's researched properly. And then if we scroll further up the page, we can see an email from Professor Sir Chris Whitty, at the very top there, in which he responds saying that about the kind of research that he thinks would be appropriate into this issue. So the email sets out that there was knowledge, of course, in May of 2020 about pediatric multisystem inflammatory syndrome, which is another post-viral sequelae of COVID-19. We can take that down now. What messaging do you think ought to have been given to the public by the chief medical officer following this sort of knowledge in May of 2020?
Absolute clarity that families needed to protect their children. They needed information to make informed decisions, and without that information, many families didn't know to protect their children, and now they're members of our group.
I see. I've already asked you about the statement in your witness statement about the need to reassure members of the public. But if we're concerned ourselves at the moment with the return to school in September of 2020 and the consensus statement made by the chief medical officers, do you think that, considering the importance of education to children and young people, that it was necessary for public health bodies to reassure parents that children had a much lower rate of hospitalization and severe disease? Would you accept that?
Somewhat accept that. I think that you can't look at just the hospitalizations on their own when by then we had huge numbers of families coming forward with what was happening in the community. And in my own case, we weren't able to get our daughter into hospital because the hospital was only interested in whether she could breathe or not. The fact that she was unable to leave her bed was not of interest to them.
I see. I'm going to ask you now about the school's policy, touching on long COVID in children and young people. What was your members' experience of school support for pupils and families with long COVID?
Sorry, would you mind asking that question again? Sorry.
Of course. What was your members' experience of the school support for pupils and families with long COVID?
Nothing. There was no support. There was no understanding. There was no guidance for schools. Worse than that, families were experiencing sort of punitive measures with not attending and complete lack of belief. The schools wanted medical documents, which we couldn't get because healthcare professionals didn't know anything about long COVID. There was no support there either. So the whole system just crumbled and children were left abandoned.
What could schools have done better to support children and young people with long COVID to access their education?
Well, they needed guidance. They needed clear guidance because as an organisation, we tried to provide guidance and help families, help schools to support families. But there wasn't any, and because it wasn't coming from the Department of Education, schools were reluctant to accept any other information. But they needed flexible and hybrid learning options. They needed a flexible timetable. They needed different ways of accessing education, one-to-one support, mobility needs in schools. The list goes on, and without, it didn't matter what anyone said. If it wasn't coming from the Department of Education, it was just a flat answer of no.
Okay. We'll go on later on in your evidence to deal with the issue of guidance from the Department for Education. But just for now, we can say that no guidance was issued. Is that right?
No.
Okay. In terms of the medical response to long COVID, what difficulties did your members face in getting access to specialist pediatric care?
Well, initially there was no care. Our members reported that they couldn't even get their GPs to believe that their children were sick. The narrative at that time was that children did not get sick from COVID. And there was a lot of pressure on families to send their children back to education or to make them try harder. And as a result of that, it left very overwhelmed and isolated families struggling, which had placed additional burden on them on top of the wider pandemic experience.
In your witness statement, you also refer to a failure to apply the NICE guidance, which was published in late 2021. Is that right?
Yes, that's right.
And a failure to collect and report routine data.
That's right.
Is that right? Okay. And an absence of a clinical case definition until February of 2023.
That's right.
Okay. I'm going to take you now to the Children and Young People's Voice report. Thank you very much. It's INQ 000587936. Children and young people with post-viral conditions described assessment and treatment journeys that were uncertain, emotionally challenging, and complex. This included some of those with long COVID, and all of those interviewed who were eventually diagnosed with PIMS, likely due to limited awareness of the condition. And then if we turn over to page 143, this is an account of a child aged 17 years old. I felt like I was kind of like pushed around. Nobody wanted my case. My feeling is that the mental health people had no idea of what ME, which is chronic fatigue syndrome, is or what long COVID is. So you just find yourself having to explain again and again. And when it got to crisis point, you know, my mom had to really sit me down and like beg me to try and talk to people, because at that point I was so wary of any sort of like counselor or therapist. Have your members experienced a similar lack of understanding from healthcare professionals?
Yes, it's commonly reported in the group that children and young people don't want to talk about their mental health for fear of having their physical symptoms minimised.
I'm going to ask you now about the school awareness pack. Long COVID Kids prepared a school awareness pack to address the lack of guidance in place for schools with pupils who suffered from long COVID. Is that right?
That's right.
And can you just give us an idea of the kind of information that was in the school awareness pack?
So it was essentially information to try and help families reduce the risk of SARS-CoV-2 infection. We shared the updated information from the government because it was changing so quickly, it was difficult to keep up with. We talked about ways that schools could reduce risks for children and try and help them with clean air, with air filtration.
If I can just pause you there. So reduce the risk of infection.
Yes, reduce the risk of infection.
Yeah.
And we shared any information that was available to try and help give families the information to make their own informed decisions.
Okay. In May of 2021, the Department for Education prepared a note on long COVID as an internal document which acknowledged the need for schools to be provided with official information on the disease. The note included a reference to misinformation and a concern that the awareness pack overstated the risk. If we can pull it up, please. The note itself is INQ 000542722. And we're looking here, it should be on your screen, Ms. McFarland, paragraphs 15 to 18. It says PHE and DHSC have raised concerns about the potential spread of misinformation on long COVID in children. The advocacy group Long COVID Kids have produced a school awareness pack. The Scottish Government has received correspondence asking whether it would be distributing the pack to schools. There is concern that this misinformation could be directly distributed to schools. PHE and DHSC are concerned that the information pack risks overstating the prevalence of long COVID in children, which some children may suffer from. Post-COVID symptoms, these may not hugely differ from other post-viral symptoms. Long COVID kids are also calling for robust aerosol transmission mitigation measures in schools and policies on school attendance and return to school, as well as greater public awareness of long COVID in children. And then, just the paragraph 18, we are discussing options with PHE and DHSC. One route is for PHE and DHSC to provide key messages and guidance on long COVID in children, which DFE could help to distribute via our comms channels and links with schools. And what I'd like to ask you is, firstly, did long COVID kids have any direct engagement with the government about the school awareness packs?
No, we tried, but there was no engagement.
Okay. The note refers to an option of providing guidance on long COVID from the department. Did that happen?
No, it did not.
Okay. How did you feel when you read about this reaction from the Department for Education to the school awareness pack?
I was angry. We tried so hard to raise awareness and to get people to listen. And when I read that, it made me realise that we never stood a chance of getting the truth out because they didn't want it to be out. Our information wasn't misinformation. The misinformation was hiding the facts from families.
I'd like to ask you about long COVID kids' engagement with the Northern Ireland Department of Health or other Northern Irish public authorities about long COVID. Has long COVID kids engaged with these bodies?
I'm so sorry. Would you mind asking that again?
Of course.
My apologies.
Would you like a moment?
No, it's fine. Thank you.
Okay. I'd like to ask you about long COVID kids' engagement with the Northern Ireland Department of Health or other Northern Irish public authorities about long COVID. Has long COVID kids engaged with these bodies?
We have not. We've tried.
Okay. I'd also like to ask you whether long COVID kids has had engagement with the Welsh Government or public health authorities.
Again, we've tried.
Okay. To the extent that it has not already been covered in your evidence, can you tell us of long COVID kids' overarching assessment of the approach of the governments of the UK to long COVID in children?
Our children were dismissed, minimised, gaslit, ignored, hidden, and that continues to be the case now. That there hasn't been any correction to the early messaging. The government has not treated our children as part of society, and what happened to our children could happen to any child. And all we ever wanted to do was raise the alarm. And when we did that, when we shared information, we thought that they would be interested and that they would pick it up and that they would make a difference. And they didn't. And so we just kept going because what alternative was there?
Finally, Ms. McFarland, I'd like to ask you about the impact of long COVID on your daughter. You set out in your witness statement a case study about a child K, and that is your daughter, is that right?
It is, yes.
Yes. Can you tell us what your family's experience was with long COVID with your daughter?
So my daughter and I both got COVID in March 2020. Me first and Kitty very quickly after. My daughter, she had initially mild symptoms, and then within 4 weeks of the original infection, it became very clear that she was not recovering. Initially, her symptoms were high fevers. She was translucent. Her skin was translucent. She couldn't feed herself. She couldn't do her personal care. She couldn't leave her bed. She would crawl along the landing to get to the toilet. Being upright on the toilet was impossible for her. She would have seizures. She had severe pain, heart palpitations. It was horrendous. She still lives with those symptoms, although better managed, but only because we've accessed private care. It's been life-changing, and as a family, at the time there was no information. One time we tried to speak to a healthcare professional at a medical appointment for me, because they were not giving medical appointments to children at the GP surgery. And I was told that my daughter was mimicking my symptoms, even though they had never seen my daughter, and that she would be fine when she got back with her friends. Later on, we tried to call 111, and as I mentioned earlier, we were told if she was breathing, she didn't need medical help. And we were so terrified. We were doing 20 minutes observations on her because she was unable to talk. And yet they just kept saying that children didn't get sick. And because of that, we just couldn't get anyone to believe us. The implications were it was a mental health problem because she was not with her friends. And yet she was desperately, desperately sick.
Thank you, Ms. McFarland. My lady, there is one question.
There is?
Approved.
Miss Iyengar, just there.
Thank you, my lady. Ms. McFarland, I'll be asking you some questions about a document that's been disclosed from the Department of Education. It's INQ 000542824, and it will shortly appear on our screens. As it comes up, I can tell you that the first page we will see that these are meeting minutes of a permanent stakeholder group meeting from the 9th of June. It should be on your screen. And I can reliably tell you that this refers to the year 2021. And we see at page 1 a number of attendees, representatives from the local government association, teachers' unions, the National Children's Bureau, schools, colleges, the DofE, and then on the left, under PHE, which denotes Public Health England, Dr. Shamez Ladani is listed as attending. And we also see apologies from the Children's Commissioner and other invitees. Were long COVID kids ever invited to attend the Permanent Secretary Stakeholder Group meetings on education?
No, we were not.
And if we scroll down in the same document, page 3, paragraph 2.2, we see that Dr. Shamez Ladani joined the discussion to explain research into long COVID. And I'd like us to look together at the 4th bullet point under 2.2. I hope that will be zoomed in on very shortly. The last line of that bullet point notes, Dr. Ladani was clear that children should not be labelled with long COVID, i.e. a medical condition, as this has potential to cause longer-term psychological harm. Ms McFarland, what is your reaction to reading what was advised by the representative from Public Health England?
It cut me to the absolute core when I read that. That's the representative that should be representing my child and the other children. And he says label, I say diagnosis, and without a diagnosis, our children were unable to access care or to be believed, and that put additional pressure on families and children, young people themselves. It brought additional stigma. It makes me wonder if they wanted a barrier to stop our children being diagnosed because they didn't want people to understand the amount of children that were getting sick.
Thank you, my lady.
Thank you very much. That completes the questions we have. I appreciate you found it very distressing, so I'm particularly grateful to you for coming along. And I hope, as you say, that you've managed to access private care. I hope your daughter does improve. How old is she now?
She's 19, she'll be 20 next week.
Right, well, I hope that she does manage to get her life back on track.
Thank you.
And thank you for all you've done to support other people in your position. Thank you very much indeed.
Thank you.
And thank you to your colleagues who helped with the inquiry.
Thank you.